Friends, I am Dr. Pratap Singh Rathod. I have done MD in forensic medicine. In today's video, we will discuss about other remaining metallic poisons. In that, first we will discuss about thallium. So, in thallium, thallium sulfate, thallium acetate are the important salts which are odorless, tasteless, and water-soluble compounds. They are usually used in tie and glass industries and are used as rodenticide and insecticides. Coming to signs and symptoms of thallium, they occur after 1 to 12 days after therapeutic dosage of thallium which is given or overdosage of thallium, or because of idiosyncratic reaction to adverse reaction to thallium. In mild cases, there is pains in the legs and feet, loss of appetite, stomatitis, drowsiness which pass off in few days. In severe cases, there is colic, vomiting, pain in muscles, joints and nerves, lethargy, motor-sensory neuropathies, convulsions, psychosis, optic neuritis, tremors, delirium and coma. There is hair loss which occurs in 1 to 2 weeks. Loss of outer third of eyebrows is very significant indication of thallium poisoning. There may be cardiac manifestations also present. Maculopapular skin eruptions having butterfly distribution on the face is also characteristics. In macular distribution in the face, there is usually butterfly appearance, means near the chin there are butterfly distribution of skin eruptions are seen. There may be mesh lines on the nasal present. So mesh lines are nothing but white colored bands which are seen in the nails, which are seen in any metallic poisons. Some metallic poisons they are present. Death usually occurs due to respiratory failure because of respiratory paralysis or respiratory muscles. After recovery, patients suffer from peripheral neuritis resembling Guillain-Barré neuritis. Death appears natural, and cause of death may be given as natural cause of death only. Since thallium is a metal, it is radiologically can be detected in intestines and which is deposited in the liver. Fetal dose of thallium is 1 gram. Fetal period is 24 to 36 hours. Coming to chronic poisoning of thallium. Thallium has a triad of characteristics alopecia, that is loss of hairs, skin rashes, painful peripheral neuropathies, and mental confusion with lethargy. So this is in chronic poisoning of thallium, this triad of symptoms are usually present. Coming to treatment, stomach wash with 1% potassium iodide or potassium blue is first to remove any unabsorbed thallium. Later on, activated charcoal is given to remove adsorb any remaining thallium. Persian blue is potassium ferric cyanoferrate 250 mg per kg per day orally is given to contract the thallium as a chelating agent. Hemodialysis along with hemoperfusion to remove any poisons. Then forced dialysis also given to remove any remaining poisons. Coming to postmortem appearance, signs of asphyxia are present since a person dies because of respiratory failure. So signs of asphyxia will be present. Mainly respiratory failure is because of respiratory muscle paralysis. Mucosa of stomach may be inflamed, and some mucosa particularly hemorrhages are present. Alopecia, which is a significant change in thallium, that is loss of hair, stomatitis, fatty heart and liver, renal damage, pulmonary and cerebral edema are also seen. It can be detected in ashes of even in the burnt body. So even if the person is died and the body is burnt also, the thallium can be detected. Coming to next metallic poison, that is manganese. So manganese is a important compound of manganese are the potassium permanganate and magnesium dioxide. So Parkinsonian symptoms are usually produced because of magnesium poisoning, which cause of inhalation of vapors of manganese for a long time. Coming to potassium permanganate, which is the important product of manganese, which is also poisonous and which is easily available. It occurs as a dark purple slender crystals and has a sweet or stringent taste. It is a powerful oxidizing agent, hence it is used as a disinfectant. Many times potassium permanganate is mixed with water and it is used as a form of disinfectant. Action of potassium permanganate, in strong solution or in solid state, it acts as a corrosive or a strong irritant, while after absorption it causes paralysis of heart muscles. It causes coagulation necrosis and brown discoloration of mucous membrane. Coming to signs and symptoms, there is burning pain from mouth to stomach when the person consumes the crystals. There is nausea, vomiting, intense thirst, diffuse difficulty in speaking or swallowing, dyspnea, stridor, persistent spasmodic cough is present. The lips, gums, teeth, tongue, and tonsils and pharynx are discolored. So there are discoloration is seen in lips, gums, teeth, tongue, tonsils, and pharynx, which are inflamed and superficially corroded. Later on, these areas, the color will change from purple brown and become to dark brown in few minutes. Later, coal black due to formulation of manganese dioxide. Shock is sometimes severe and there may be immediate collapse may also be seen. 5 to 10 gram of potassium permanganate is fatal. Fatal period is few hours. Treatment: gastrolol should be continued until the washings are colorless with 20% of sodium thiosulfate, which is used in initial washings, and it is continued till the washings are clear. Some demlucents are given. So demlucents like egg white or anything like starchy material of milk is given. Medicinal charcoal is also given. A symptomatic treatment is usually prescribed for potassium permanganate. Come to circumstances of poisoning. So potassium permanganate, as I mentioned, is a oxidizing agent and is used as a disinfectant. So it can be easily available and is sometimes used as a suicidal can be used. Accidental poison occurs when the children who may eat the crystals in mistake for sweets. It is also sometimes taken orally as a abortive agent. It is rarely used to produce fictitious injury, that is to stimulate the lesions of tertiary syphilis by applying tablet on the skin for 20 to 20 minutes. When this is applied, it causes corrosive effect and it may stimulate like some diseases, and the person may try to escape some duties or he may try to produce some fictitious injuries. Sometimes tablet is inserted into vagina to produce abortion, which causes ulceration of vagina volar cervix. Next metallic poison is the barium. Poisonous compounds of barium includes barium chloride, which is colorless rhombic crystals, barium nitrate, barium carbonate, which is used as a rat poison, barium sulfate, which is a heavy, white, tasteless, odorless powder used for X-ray examination of gastrointestinal tract. Similar to thallium, barium is also used one form to visualize the intestinal tract, and it is used. It is insoluble, and the barium sulfate is the commonest product for that purpose. Barium sulfide is a deadly poison and is used as a depilatory. Coming to action of barium, it acts locally, has a irritant of almost corrosive degree. After absorption, it causes corrosive effect on muscles, including heart muscles also. So whenever if it is acts, it gets deposited in the body, in muscles, it becomes corrosive effect, and it also can deposit in the hearts. Coming to signs and symptoms, the first effects are those of severe gastrointestinal irritation, namely nausea, vomiting, and diarrhea. Later on, there is cramps, stiffness of muscles, dilatation of pupils, paralysis of tongue, larynx, and vertigo. The heart is affected early, the blood pressure rises, pulse is slow and irregular, and the heart may stop in systole. The most characteristic changes are in the AF reflexes, that is abscess of reflexes and paralysis of muscle. Fetal dose is about 1 gram. Fetal period is usually within 12 hours. The person will die. Coming to treatment, stomach wash with 10 ml to 10% solution of sodium sulfate, which given for every 15 minutes to convert soluble salt into insoluble sulfate. So it combines with barium to form insoluble barium sulfate, as I mentioned, which is also used for barium sulfate used for X-ray purposes. So it is insoluble and it is easily excreted. Repeated bowel wash is given and simple treatment is given to remove any remaining unabsorbed barium. Coming to antimony, antimony is a metallic form. Antimony is not poisonous and salt form will be poisonous. Antimony potassium tartrate, tartaric emetic, occurs in the form of whitish or whitish yellow powder, and antimony trichloride or butter of antimony are poisonous. The mode of action and symptoms of acute or chronic poisoning are similar to produced by arsenic. So any sign symptoms is similar to that of arsenic, which usually causes gastric symptoms and it causes diarrhea. So that is the main changes in arsenic poisoning which causes, and it causes that similar signs symptoms are similar to that of antimony. Fetal dose of tartaric emetic is 0.2 to 0.5 grams. Antimony trichloride is 0.1 to 0.2 gram. Fetal period is within 24 hours. Treatment: stomach wash is given to remove animal poison. Tannic acid 4 grams by mouth forms insoluble antimony tannate. BAL for chelation purposes, and symptomatic treatment is given for any symptoms which arises. Coming to nickel, nickel exposure to nickel for chronic exposure to nickel causes usually lung cancer. Other than that, there is no any changes. Cadmium again poisoning causes proteinuria and painful bone lesions known as Auchow's disease. Can it cause bony lesions, which is causes the disease. So these are the other metallic diseases. There is one condition caused by metals, which is called as metal fume fear. It caused by many metals. It is caused by inhalation of fumes of zinc, copper, magnesium, nickel, mercury, lead, iron, silver, chromium, cadmium, cobalt, antimony, and manganese. So any this metal, mainly in the workers, factory workers, inhalation of this metallic fumes causes metal fume fear. These symptoms includes flu-like illness, which starts 6 to 8 hours after exposure of fumes, with fever, chills, cough, dyspnea, cyanosis, myalgia, salivation, sweating, and tachycardia. So usually it starts as a flu-like symptoms. Later on, it may lead to cyanosis, myalgia, salivation, sweating, and tachycardia. Symptoms subside in 36 hours after stoppage of exposure. So in that, mainly it occurs when persons suddenly get exposed to fumes of metals and has flu-like symptoms. Later on, it subsides if the exposure is less. These are my references. Thank you.